Would you like for me to personally help you implement a system that will allow you to add multiple six figures in hidden revenue to your dental practice? Utilizing your existing patient base, each paying you $3,000 on average, and utilizing more of your team's time rather than your valuable chair time, with no expensive equipment or tools necessary, within the next 90 days, so you can add an extra $250,000 per year or more to your dental practice. Hi, I'm Dr. Emily Stopper, and if you've never heard of me before, let me just give you a brief introduction. I'm founder of Implement Apnea Academy. I'm also a diplomate of the American Board of Dental Sleep Medicine. I've been featured in Dental Economics and The Profitable Dentist, as well as the popular Delivering Wow podcast. I'm also a dental practice owner, wife, and a mom to 4 children, and I spend only 2 days per week in the dental office working clinically. Let me ask you this. Does this sound familiar? Are you frustrated with working day in and day out with little to no appreciation for your efforts? Are you working way too hard for not enough money? Would you like to have more of a sense of purpose or fulfillment in your work? Would you like to have another source of revenue that doesn't require back-breaking, neck-wrenching effort on your part? Would you like to increase the profitability of your practice so that retirement can come sooner rather than later, and the value of your practice is higher when you are ready to sell? Treating sleep apnea is the most effective way to dramatically increase your revenue utilizing your existing patient base and bringing in a steady stream of new patients. Treating sleep apnea is also the most profitable use of your time since your team can do the majority of the hands-on clinical so that you can focus on other things, whether that be doing another procedure in a different operatory or whether you would like to just have a little bit more downtime during the day. Utilizing my proven system for treating sleep apnea, dentists are adding $250,000 per year or more to their practices without spending more time in the office, and I want to help you grow your practice using this same system too. Okay, let's briefly go over a few facts about obstructive sleep apnea. 1 out of 5 people have obstructive sleep apnea, and it's estimated that 22 million Americans are suffering from it, and up to 90% of these people are undiagnosed. People with untreated severe obstructive sleep apnea are 5 times more likely to die of cardiovascular disease than those who don't have it. These are some startling statistics, and really something needs to be done about it. And it really all starts with us as the dentists, because we're the ones that are looking in patients' airways day in and day out. We see these signs and symptoms all the time: hypertension, acid reflux, depression, the list goes on. And even dental signs and symptoms. When we look in people's mouths, there are definitely red flags that we can see and we can identify. And we're really responsible for being able to point these patients in the right direction. Even the ADA has given us a policy statement on this back in 2018, encouraging dentists to screen for sleep-related breathing disorders as part of their comprehensive medical and dental history. So it's really up to us to do something about this. So let me ask you a quick question. How many patients are walking into your practice every single day? And I'm not just talking about the patients that you see. What about your dental hygienist or your associates in your practice? I want to give you a brief example just to show you the impact that sleep apnea can have on your dental practice. For the sake of this example, we're going to say 15 patients per day walk into a dental practice. Now, this office, let's say they're open 4 days a week. So that's 60 patients that walk in and out of this practice each week. Given our statistic that we know 20% of the population has obstructive sleep apnea, this gives us 12 patients every week who likely have obstructive sleep apnea. That's 12 patients per week, 48 patients per month, and 576 patients per year. 576 patients per year, and the average collections for a dental sleep appliance is $3,000. So think about that again, 576 patients that need your help, and if only 15% of those people, I'm going with a really conservative low estimate, if only 15% of those 576 patients proceeded with treatment for sleep apnea, that's 86.4 patients times $3,000. Now, since we don't have 4/10 of a patient, let's round that down to 86. That comes out to be $258,000 per year if you had a 15 patient per day practice. Now, I don't know what your numbers are, but I suggest that you plug that into that formula and consider how much money you're leaving on the table if you're not treating sleep apnea. The problem is that figuring out how to incorporate sleep apnea treatment into an already busy dental practice can be difficult and time-consuming. But my proven 6-step system is a shortcut around all that. It's the fastest method that I've discovered to quickly add an extra source of revenue utilizing your existing patient base, acquire a steady stream of new patients who are ready to begin treatment the same day, and without wasting time and money trying to figure it out on your own. This system is all about leverage and simplicity.
I call it the Sierra system. Step 1 is to screen your existing patient base for potential signs and symptoms of OSA. And when you do this right, this can be done quickly and easily using less than 1 minute of your hygienist's time during routine hygiene visits. You'll be offering a valuable service to your patients that they want and need. Step 2 is all about identifying your at-risk patients based on what screening methods that you used, which takes us to Step 3, which is educating those patients on why it's so important to determine if they do have obstructive sleep apnea, and if so, to have it treated. And that's where you help to facilitate the patient actually getting diagnosed for their OSA. And if you do this right, I can easily help you create a multiple six-figure per year profit center in your dental practice. Steps 4 through 6 are all about taking your practice to the next level. When you do step 4 through 6, you're reaching out to your local medical community, you're referring your patients for appropriate sleep testing, and you're applying your knowledge. And when you do this right, you're building a machine that generates a steady stream of new patients ready to begin treatment immediately. And you're also setting yourself up for future success by making yourself known as the go-to dentist for treating sleep apnea. So what does all this mean to you? Here's how I will help you. Over the next 90 days, I will teach you what you need to know about dental sleep medicine so that you can confidently and successfully treat patients. I'll help you implement an efficient system to quickly screen, identify, and educate your patients for OSA so that you can get patients into treatment ASAP. I will share my proven systems, protocols, and templates so that you don't have to waste time and money figuring it out by yourself. And I will be available and accessible to you when you have questions or need help with anything. Plus, I'll even help you develop an accelerated plan of action so that you quickly build a network of healthcare professionals regularly referring patients to you.
So when you follow my 6-step proven system, you can save lives, save marriages, and have a more fulfilling career. And you can confidently and successfully treat patients with great results. Knowing the system and exactly how the process works from A to Z is the secret sauce to making it all work seamlessly. This is not just another sleep apnea course. This is a coaching program that will accelerate your income faster than any course could. So I'll ask you again, would you like for me to personally help you implement a system that will allow you to add multiple six figures in hidden revenue to your dental practice, utilizing your existing patient base, each paying you $3,000 on average, and utilizing more of your team's time rather than your valuable chair time, with no expensive equipment or tools necessary within the next 90 days so that you can add an extra $250,000 per year or more to your practice, and you want to avoid wasting time and money trying to figure it out on your own so that you can stop leaving money on the table and add a very valuable service to your patients, then schedule a call and fill out a brief application to speak with me or one of my team members. If we work together, we'll create the same process and systems for you that I use in my successful dental sleep medicine practice. I will show you how to achieve your goals, whether that's more patients, more revenue, more time freedom, and help you impact hundreds of lives in the process. I will warn you, there are limited spots available. If you're seeing this video right now, that does mean there's spots still open. I am only accepting 5 dentists per month in my coaching program, and when those spots are taken, there will be a waiting list. My time is extremely valuable to me, and any time that I spend away from my family, I really want it to count for something. So this program truly is very important to me, and I am devoting my team and my own resources to your success. So it's important to me that anyone who enrolls in this program is a great fit, not only just for you, but also for me and my team as well. I only want people who are committed to this process and who are ready to be successful. So with that said, I'm really only looking to work with people who are motivated, who are committed to success, and who are ready to get started right away. So if that's you, go ahead and schedule a time to speak with me on the phone, fill out the application after you schedule the phone call, and I look forward to speaking with you.